Here at DBL, we want to be your eye in the coronavirus storm, and that's why we have facts and answers to your concerns and questions. And we can do that thanks to our medical expert, Dr. Pyle Kohli, who joins us live. Hi, doctor. So as the COVID-19 vaccines roll out, we know that you yourself has gotten one. There's still so much that we have to learn. Can you give us a status update on how the vaccine rollout is going?
You know, guys, if I'm being totally honest, I don't think we're in a good place right now with the vaccine rollout, and that's largely because of the logistical problems. By the end of 2020, we were supposed to have 20 million doses of the vaccine given, and we've only had about a quarter of those actually handed out. Doses are being misallocated, so there are being too many doses sent to some places. They're having to vaccinate low-risk people to prevent the vaccine from being thrown out. So it's just really not going well, and I do think we need to get our act together because we need to ramp it up and start to deal with some of these growing pains. Now, on the other hand, people are tolerating the vaccine really well. So those people that have gotten it, we're not having any big surprises there. So I am pleased about that.
Doc, some people are finding that they have allergic reaction to this, including anaphylaxis. Is this more or less common?
You know, Jeff, what we're noticing is that it's more common than, for example, with the flu vaccine. So the rate of anaphylaxis that we're seeing is relatively rare. So far, only 29 people out of 1.9 million people. So that puts us at a rate of about 11 people out of every million. Now, if you compare that to the flu vaccine, which is about 1.3 out of every million people, it is a little bit more than the flu vaccine. But still, I want to emphasize, incredibly rare. And of course, the benefits of the COVID-19 vaccination far, far outweigh those risks.
All right, Doc, what type of people are at highest risk for having some sort of reaction? I know it's people with EpiPens that have really strong reactions. My dad has like a very bad seafood allergy reaction. Is he someone who might not want to take the vaccine?
Yeah, that's an interesting question. We're actually seeing even people without a history of allergic reactions can have this type of reaction. But you're absolutely right, Tori. It's the people that have history of anaphylaxis, the ones that use EpiPens, the ones that have severe reactions, mostly to medications, but potentially also to food. But again, I want to emphasize that even these people should take the vaccine because the rate is relatively rare, but they just need, I would ask your dad, for example, to talk to his allergist before he signed up for the vaccine. Now, they are saying that if you've had an allergic reaction to the first dose, you shouldn't get the second dose. They're also saying if you're allergic to any of the known components like polyethylene glycol or polysorbate, those are the preservatives that are in there, then you want to be careful about taking it. But very small people that shouldn't take it based on their allergic reaction history.
Good to know. Now, Dr. Kohli, we've talked about this before, but DBL Nation keeps asking, so please provide some clarity, especially if anything has changed. When it comes to facial fillers, Botox, how does the vaccine affect those with injections? Yes, Tori.
No.
Yeah, you missed that.
I don't have any.
Me either. So you guys, Botox, we haven't really seen a signal for. But with facial fillers, if you think about facial fillers, it's basically like having a foreign body or an implant inside your face. So what we saw in 3 patients in the Moderna trial, 2 who had gotten facial fillers within 6 months before, and 1 who got it 2 days after the vaccine, was that the vaccine can trigger an immune response to the facial filler. So it can cause facial swelling or facial edema, like we call it. Usually pretty mild, usually treatable, not a contraindication to getting the vaccine if you've had the facial fillers. But if you're thinking about getting a facial filler, I might recommend putting it off for now until you get the vaccine and until we have more information.
Great info.
Woo.
Wow, I know.
I'll pass it off to my friend who gets it.
We appreciate you, Dr. Kohli. We'll be right back.